we did a few infographics, and we'll show you how to find them on our website at the end of this presentation. But this first infographic really shows the main or the key messages that we presented in our report, which is the first one. Virtual care is easier and more gives easier and more timely access to care for specific needs, and I'll come back for this part later on in my presentation. Also, in terms of continuity of care, there was many concern that has been raised. We also heard a lot of stories and people telling us that yes, virtual care can be a good tool, but it cannot always replace in person care in terms of communication, comfort level. Virtual care is often perceived as impersonal. We've heard that a lot as well. And lastly, there's some barriers to accessing virtual care. Um, in terms of literacy or technological tools, accessing virtual care is not easy for everyone. And there has been difficulties raised in terms of accessing virtual care in the language of choice, specifically for the francophone. So our report captures what we've heard the most in terms of our health quality dimension, like we've presented to you during those various engagement activities. So in terms of accessibility, virtual care allows easier and more timely access to primary health care. Um, Such as specific needs for like blood test follow-ups, renewal of prescriptions, etc. In terms of virtual care, it also offers greater accessibility for people with disabilities. We've met with a few, and that's what we've heard in terms of accessibility, that it was sometimes easier for them to access care in a virtual setting. We've heard a lot that virtual care, those are the advantage, obviously, that virtual care saves a lot of time and a lot of money. So people don't need to take time off work. They don't need to get childcare. They don't need to travel. So there's less expense from their end to be able to have access to care. On towards the challenges that we've heard, it's like that the various type of virtual care are not well known. So people were often confused with e-visit, Maple Clinic, NB Helpline. So all those different type of services when we think about virtual care. So that's why in our citizen brief, our final report, we have a page that well present the various options to make it a little bit more easy to understand and to navigate care in a virtual setting. In terms of challenges as well, like I've mentioned earlier, not everyone has the digital literacy or technological tools to access it. So we heard a lot of concerns during this aspect. Sometimes it's hard for people to express themselves in a way to be well understood in a virtual setting. People were telling us that the virtual care isn't as the approach is not as human as if it was in person. And that barriers in communication were significant for some. Other people said that they were reluctant to use the virtual care option as they do not necessarily feel comfortable with technological tools. Someone told us, and as you see in my presentation, there's a lot of quotes. So it's word for words of what we've heard from citizens that we've met. And there are a lot of quotes in my report as well. So at the end of this presentation, we'll guide you on our website how to access it, and you'll be able to find all those different codes that really do capture the various experiences when we think about virtual care. There's a lack of access to virtual care in the official language of source. Sorry, there's a little in petit coquille here in the presentation. So in terms of like francophone communities, we've heard a lot that they had difficulty accessing care in their language. From the primary care provider perspective, most primary care providers seem to agree that virtual care facilitates access to their services. During the pandemic, obviously, they've kind of noticed that they were able to reach more people that often were difficult to reach since they didn't not add the proper resources. Stay-at-home mothers, single mothers, people who were not able to afford to travel to their office in terms of transportation option as well, seniors. So in a sense, virtual care made the access better for those people. For the most part, what we've heard from citizens in terms of appropriateness and effectiveness of the care received, they were satisfied with the care that they received virtually. Although there was, again, some communication barriers have been raised. Sometimes it's hard for them to explain how they feel on the phone. It's difficult to get your point across. There were worries that where we're going to have less and less physical exams and less appointment in person. So those were the concerns that has been raised. Like I've mentioned, virtual care is perceived as impersonal. People were preoccupied about the lack of continuity with other healthcare services. So for someone who has a healthcare provider who seeks care in a virtual setting, let's say with e-visit, they don't have your record, they don't have your medical history, so the continuity of care, which is lacking in terms of like all the information that has been shared, were also a concern raised multiple times during our various discussion. And also virtual care can be appropriate and adequate for specific needs, just like I've mentioned earlier. Another advantage, not an advantage, but something that has been raised is that virtual care can be a good tool, which is one of our key messages, like I've mentioned, but it cannot always replace in-person care. So the limits of virtual appointment, the fear that they're going to lose their clinical experience, talking from the doctor's perspective. Um, so those were also concerns from the primary care providers as well. In terms of equity, obviously not everyone has the tool to access virtual care, so people were concerned about those aspects. People living in isolation, poverty, it's quite difficult for them to access care. But in other cases, for people, virtual care made accessing care more equitable since it's available for everyone, including ones who don't have any care providers. So I've talked with a few people who don't have a healthcare provider. So for them, virtual care is an easier access um, in terms of their situation. In for the primary care provider and the equity dimension, some of them told us that virtual care is equitable because their patients always have the options of being seen in person. So the importance of having the choice, and it's something that the citizen also really did value. Yes, virtual care, but I want to be able to choose. What's the best modalities of care I want to receive. So yes, virtual care, but it needs to come from like a patient-centered perspective, I guess. Other thing that came out a few times is in terms of guidance. So for the healthcare provider who works more closely with like a vulnerable clientele, guidance is really like the key element to make sure that those people are accessing care, but there's need to be more resources to help them be able to do so. In terms of safety, virtual care is an effective way to reduce the risk of virus transmission. We've heard a lot. from citizens, such as like in the pandemic. Um, so that's an advantage, but in terms of challenges, virtual care can also potentially increase the risk associated with intervention. So, being diagnosed too late or not having the right diagnosis. So, those were the main concerns as well. For the primary care provider, in terms of safety, virtual care is safe, but it needs to be used properly. So, there's like the clinical judgment that is really important. So it has to be based on standards. So we've heard those main things when I've met with the primary care providers. And also, virtual care allows for greater safety as it could prevent falls and the transmission of viruses and disease, same as we've heard from citizens. While for others, the accuracy of the care received can have an impact on patient safety. It's the same kind of concern in terms of continuity of care. There might be some danger if you don't have the all the information to be able to uh, give a good diagnostic. Diagnostic. Yeah. In terms of efficiency, from the primary care provider that I've met with, virtual care offers potential in terms of resource efficiency, particularly since it moves people away from the emergency rooms. So, virtual care allows us to have a better management of resources, and it often save people to go to the emergency rooms, perhaps. Some care provider noted that virtual care allows them to use their time more efficiently. It frees up their schedule. It leaves more room for patient who needs to be seen in person. So that was also an advantage in terms of efficiency that was raised. There was other teams that emerged during our engagement activities that were not within the health quality dimensions that we have here at the New Brunswick Health Council, such as virtual care helps to take the pressures of the overloaded healthcare system. We've heard a lot about this. People were aware of like the challenges that we face within our healthcare system, but that virtual care can be a tool to overcome this. Also, the importance of being able to choose the modality of care. So, people really did value that aspect. Yes, virtual care, but I want to be able to make my own decision and be able to choose if I need to be seen in person. And also, other thing that was quite interesting, we heard a few comments of the advantage that we have with virtual care in regards to the environment. So it has less of an impact on our footprint, I guess. When we did our focus group and also my interviews, and we kind of captured that also in our online session, at the end of all those activities, we were asking people to give us suggestions for improvement. And if you were the one who decide within the healthcare system, stakeholders, what would be the suggestions that you would have for us in terms of improving the access to virtual care in New Brunswick? So I tried to capture the three main improvement that came out the most during our various engagement sessions. And they're all also presented in our final report. So first one, it's there needs to be a better promotion of virtual care option. So the lack of promotion of virtual care options seems to be a key issue in terms of accessibility. On many occasions, people express hopes that information on virtual care option would be better communicated so it can make it easier for everyone to access it. Second improvement suggestion in terms of improvement was there's also needs to be better guidance. There needs We need to find ways to make it more organized. make it more accessible, equitable for everyone. Various ideas came out, such as making partnership with community center, having more strategic locations so people can access computers and have guidance, support system, a better support system to make sure that everyone has access, specifically the most vulnerable. And lastly, it's the better continuity of care. So patients' medical information should be available to all healthcare provider, to help facilitate the delivery of relevant services based on their needs. Like I've mentioned earlier, in terms of what we put out there, in terms of like information that we captured during our various engagement activities, we did a few infographic that are being presented on our website, and there's also some of them we have posts on our Facebook page. So we had one infographic, which is virtual care in New Brunswick. And this infographic captures mostly the numbers. So, in terms of our last survey, in terms of primary care, we had a few data in terms of virtual care. So, you have a better understanding of like how many people access it, what kind of modalities, etc. Mostly people, how they were satisfied. So, those are more the quantitative data that we have in terms of virtual care in New Brunswick. Access to virtual care services in New Brunswick. The second one, or the one in the middle that you see, captures the different modalities of virtual care. Um, so we kind of did an infographics to explain what is NB Health Link, what is telecare, what is e-visit, etc. Because there was quite often, not always, but often some misunderstanding of the various services when it comes to virtual care. And the last image is an example of a key message that we shared on our social media. So on our main page, I guess, if you scroll down just a little bit, you have here virtual access to primary care, what we've heard. This is the web article with the map that I've presented to you and the four key messages. At the end of this, as you can see, read the full report. If you click, you have access to the citizen brief, the report, which is 34, 35 something page. Introduction, we have the message of our CEO, Stéphane Robichaud. A little bit of background. Obviously, not everyone knows what is the Patient Voices Network, the objectives, a few definition, what we mean by virtual care. Um, we also captured the dimension of health service quality in a graphic. I explained a little bit of the methodology, engagement principles as well. Who took part, the map again, the various engagement activities, what kind of question we ask in each of those. And the most important part, I guess, is the citizen testimonials. So, as I've mentioned, a lot of quotes. The key themes are all presented. There's also a summary at the end of this part, you see kind of like, yeah, right there. So we captured the main inventions and challenges that were raised by citizens when we think of all the health quality dimension. There's also a part for the healthcare professional in terms of testimonials. We divided those things into, I guess, even though there was like common theme that emerged from all of this. Also in our report, you'll find distinct part on the summary of testimonials regarding eVisit NB, since we heard a lot about eVisit NB throughout our engagement activities, what went well, but mostly what were the challenge that were identified by the participants and what the participants suggested in terms of like improving the platform. And at the end of the report, you'll find the key suggestion I just presented to you, conclusion, and then lastly, a few other quotes that really do capture the challenges, but also the advantage. So there were like both of the spectrum of experiences. Some were good, some were less good, and that's what we tried to capture in this report.